How are you
Yes,
doing?
thank you. Good, thank you. That was yeah, very interesting to listen in on because of course my first time today as well. So yeah, thank you for letting me tune
You're,
in.
you're very welcome. And yeah, you're also in Australia. You said Adelaide, yes?
Yes, yeah, exactly. Um I actually thought I might raise something new that I didn't message through today just because sort of the opportunity has arisen if that's okay. Um where I've got polycystic ovarian syndrome, and as a part of that, I have very irregular cycles. But it just so happens this morning, um, one came on, and it has actually been a really painful one. So I thought, if possible, would that be all right to maybe have a go with
Absolutely.
that? Yeah.
Yeah, in the past, I had
Perfect.
lots of success with ovaries and ovarian cysts and things like this. So
Oh, perfect.
it works differently with everyone, you know. So tell me, your cycles are irregular, and right now you have pain there, right? I'm going to get on with the healing as soon as I possible, and then we can talk about it afterwards, all right? So
No
basically,
worries.
you have a pain now in your abdominal area, correct?
That's
How about in
correct.
your back?
Yes.
Um, the pain
Not
goes all
not
around the
this
back or
time.
just in your tummy?
Just in the tummy, yeah. Sometimes it has been the back, but not this time.
Not this time. Okay. What is the level of pain, Sarah, from 0 to 10?
It has gone down a lot since this morning. I'd say at the moment it's probably a, a 2 to 3, and it's kind of that quite heavy feeling, I'd say, as well. So yeah, unfortunately it's not as bad as it was this morning as a test, but there's definitely still something there, hopefully, to work with.
Okay. 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 And you have a heavy feeling as well. You feel really heavy down there, right?
Yes,
I'm just
yeah.
trying to remember. I get that heavy feeling as well, but very rarely. So I
Okay,
think I know
yes.
what you're talking about. Yeah.
It's
So
almost like, yeah, tight and kind of,
tight,
yeah,
like
weighed
somebody's
down.
holding it's like somebody's holding your insides, like in the fist, right? Tight. And then also there is
Exactly.
a pain 2 or 3, you said, right? Okay.
Correct. Yeah.
Okay. If you please relax as much as you can, just be comfortable and then close your eyes and I'm coming.
Thank
All right. Oh, oh. Oh. Sarah?
you. Yes.
Hiya. How are you feeling?
Yeah, I think definitely lighter, and not that sort of tightness feeling that I was feeling before.
Is it still
Interestingly,
painful?
well, I can still feel it just a little. I'd only say it's a 1, and I feel like it kind of moved. So I felt it quite evenly across both sides, but then moved to the left, but then moved up to be kind of on my rib cage rather than more of the abdomen.
Okay. Wow. And what is the pain now? Is pain
Only a 1, and only in that kind of rib cage, slightly higher up area.
on the right side, is it?
Sorry, on the left side.
On the left, on the left, sorry, yeah, left side. Left side, sorry. I'm getting so confused with the screens and people left and
It's
right.
mirrored, isn't it?
Yeah, it is. It's like this and
Very confusing.
yeah, I'll get used to it, I guess, you know. So, okay, so it's on the left, right? You said.
Yes,
Okay, I'm going to give it another go. If you would like to close your eyes and relax again for me,
thank you.
please. Mm. Sarah,
Yes.
how are you feeling now?
Yeah, no, much better, thank you. I'd say gone. That yeah, definitely eased up as well on that left side.
That is gone. And how about the tightness in your ovaries and at the bottom down here?
Yeah, not tight. I would say just a normal level as um, yeah, uh,
It's not
just sort
tight
of as
anymore.
normally sitting. No, it feels a lot lighter than it did, and yeah, it doesn't have that kind of, I guess, sort of spasmy feeling that it was feeling before.
Okay, great. Do you want to if that's all right with you, of course, if that's comfortable and
Yeah,
if it's okay, if you want to walk around and see how it feels as well. So if there is anything else
yeah,
that pops up, we can get rid of that too. I
yeah.
hope I can. Let's see.
Sorry, it's not a very big room, but I'll do a couple of laps.
Doesn't matter. Yeah, just move around. Because I remember when I was young, when I was younger, I
Yes,
used to have that tightness, but it's disappeared now for years. And I remember when I was sitting down, it was okay, but when I would move around, then it would hit me again. But it's been gone for
yeah,
years for me, so I can, yeah, I just
right.
recall how it feels, and it's quite horrible. So how is it now that you walked around a bit? Is it
It feels good. Yeah, it feels just like walking normally.
okay? So it's not come back.
No, no, it's I think at seemingly at bay, so to speak.
Excellent, excellent. So your cycle came today. Is it today's the first day? Okay,
It
so
is,
and
yeah.
usually you have it like, well, it's every 30 days, right? Or 25 to 30 days. No.
No, it's quite irregular, so it could be like once every 2 months, once every 3 months. I think
No.
once it was once every 9 months a while back.
Oh,
Um,
that's
so
fast.
it's
Okay.
uh,
Okay.
yeah, it's not the
So
best.
no, and when it comes, how long does it last, Sarah?
It, it's usually quite long. I
Like
would say on average it's probably 7 to 10 days.
that's a lot. Yeah. How old are you?
And it's usually quite heavy.
Sorry.
I've just turned 30.
Oh, 30. Okay. Okay.
Yes.
That's a nice
So
age.
it's been, it is, yeah. And it's been, I would say it's been like that pretty much all, like since when I started when I was 14. It's always been a
Okay.
consistent
Like this. So
regularity.
it comes once every 2 months, once every 3 months, or once even every 9 months. And then it lasts for 7 to 10 days. And what is the cycle like? Is it heavy? The bleeding, etc. Itself is heavy, or it comes little heavy? Heavy
No,
flow.
it's usually pretty heavy, yeah.
All the way for 7 days, heavy flow? No.
No, it usually just for the first two, and then it will certainly get less over time after that.
Right. Okay. So, okay. Okay. So what I would like to do, yeah, um, um, so as I said to Manisha as well, on Saturdays or Sundays, sometimes it's on Sunday mornings, yeah. Uh,
Yes.
I would like you, if you can, and if you would like that too, to come back and so I could do a bit more healings for you and see if we can get it more regular. So you have it every month, 3 4 days, and like as it should be.
Exactly.
So
Yeah,
it works well, your reproductive system inside, and obviously that's where something is wrong. Yeah, I don't know. I'm not a doctor,
definitely.
so
Well,
yeah.
I don't think they really know either. I did see someone recently, a GP, and he kind of didn't really know. I did some ultrasounds and other things, so I think yeah, that it's not fully understood, I guess. So I'm yeah, very willing to come back. Would love to come back. Thank you.
All right. Well, you're very welcome. And you said you did ultrasounds. Did it show anything in the ultrasound? What's anything that was not supposed to be there, like a cyst perhaps, or I don't know, anything.
Yes.
What?
Yeah. So there's quite a few cysts. They didn't tell me how many, but on both ovaries.
Oh,
Not overly big in terms of size. I think the biggest one's 1 centimeter. But yeah, and that I first did one back when I was about 20, and they found them then, and they're still there now. So I think probably only multiplying, I'm assuming, over time.
Okay. Okay. So, right. Yes, I would definitely would love to see you again on the events and see if we can get the symptoms better and improve it and make it more regular and painless and not get rid of the tightness. And then perhaps, after some time, I would love you to go back to do some more ultrasounds and see if there is any change. See if if the cysts are still there, if they're smaller. And this time, ask the details, what was before, and ask what was before and what is like now. So we'll see let's see what happened, because you're not doing any treatment or anything to get rid of the cysts or make them smaller,
No.
right? Okay, so if we maintain status quo, then we can see exactly, and I will then understand that this happened because of this work. So let's see how we go. So if you are good and you have no more pain and tightness, well, I'm gonna wish you a good day and let me see how we go. But I'm gonna be here every week, unless something happens, of course. But every week I'm gonna be here Saturday or Sunday. Keep an eye out for the events I will publish them always in the group. And
Perfect.
yeah, so I'll come and give
Wonderful.
you each time.
That sounds great. I hope hopefully we'll join in next week as well. So thank you very much.
Okay, you're welcome. My pleasure.
Thank you.
My pleasure.
Have a good